Thank you for the introduction. As mentioned, my name is Duplantis, and it's my pleasure to be presenting essentially a handful of case studies that Ailux feels represents the real-world application of AI in antibody discovery and engineering. Before jumping into the case studies, I would like to take a minute to introduce Ailux. Ailux is the Biologics division of a company called XtalPi, a global leader in AI drug research. XtalPi has been around for about 10 years, has raised over $780 million in funding through 4 rounds of financing, and we actually recently just went public this past year. XtalPi's initial focus started off on in silico small molecule structure prediction before moving into small molecule discovery, solid state chemistry, and automation. And then Ailux was actually brought on in 2018 as the Biologics division. So a little bit about Ailux itself. We have 80 team members across 3 different countries. We've actually developed over 50 proprietary AI models and have 30,000 square feet of lab space and worked with a number of strategic partners and programs to date. But I really want to, what really differentiates Ailux, or I really want to bring attention to, is the fact that unlike other companies in this space, Ailux was truly built for purpose to integrate both the wet and dry lab capabilities at the same time. So while we were building up our wet lab capabilities and producing those platforms, we were putting considerable amount of resources into producing, characterizing, and curating biologics data. So this data, along with publicly available data, was then used to train our proprietary models. So Ailux's wet lab capabilities alone would allow us to compete as a premier end-to-end antibody discovery and engineering platform. However, as I mentioned, the main differentiators is our ability to integrate both the wet and the dry lab combination. Ailux's 3 main pillars that we stand on for AI are CrystalFold, XenProt, and Zentient. So CrystalFold is our AI-guided protein-protein structure prediction algorithm. So starting from primary sequence of amino acids for an antibody and an antigen, or any other 2 protein binders, we can predict in silico the crystal structure of that complex with high degree of accuracy and in a relatively high throughput manner. This can then serve as the foundational blocks for downstream engineering and optimization works. And we're actually happy to say that we've recently licensed this to J&J for their internal use, and it's a nice external validation of this platform. The second model that we have is XenProt. This is our generative large language model for biologics. So the same way that ChatGPT will produce a sentence, produce a paragraph, or an essay based off of prompts and constraints, our generative large language model will produce what we call fit sequences based off of prompts and constraints. Why we're saying fit sequences is because not only are we identifying and trying to solve the solution associated with the biologic that's brought to us, but the sequences that are generated are also taking the overall developability of the molecule into account. So we're only generating these fit sequences that address certain issues while drastically reducing the potential search space. The third algorithm that we have is Zentient. Zentient is our predictive suite of AI models. So in essence, XenProt will produce sequences, hit generation campaigns will produce sequences, and then we can use Zentient to down-select, triage, prioritize the lead candidates that meet the multi-parametric requirements that are so often involved in the engineering and hit discovery programs that we run. So it's one thing to say this, but we also believe that this should be demonstrated through real-world data. So we've prepared 3 different case studies that showcase how we've integrated these into the discovery process. The first one is based off of discovery. The second one is on hit expansion. The third one is on our ability to refine lead candidates. The discovery campaign, what we'd like to focus on is our ability to mine the deep repertoire. The hit expansion, we've actually created a structure-guided method for essentially identifying structurally convergent yet sequenced diverse clones from having a lead candidate. And then the third one is our ability to perform multi-parametric optimization within a dual specificity affinity modulation case study. So the first case study, as I mentioned, is focusing on our ability to perform hit generation. and is Ailux's approach to identifying diverse, functional, developable, and humanized hits against different targets. We call it the Trilux 3-in-1 antibody discovery engine because the Trilux part refers to the fact that we're integrating in vivo, in vitro, and in silico technologies into this program, but we're actually also including 3 different antibody discovery platforms within a program. So the 3 different platforms are SmartFluidics, our single B-cell screening platform, ExploreSeq, our ability to identify binders from NGS repertoires, and SpeedPlay, our in-house phage display technology. And so while this is already a comprehensive antibody discovery platform on its own, where we get excited and the attention that I want to actually draw to is what actually happens after this first round of binders and our ability to add and identify very low abundant clones that are still binders. So to walk through this case study, we immunized mice with the 22 kilodalton soluble protein. We then ran through the hit generation platforms where we produced 130 binders from the SmartFluidics platform. Using our pre-trained AI model, we were able to identify 85 binders from the NGS dataset, and then the phage display produced 67 binders. At this point, we can take the data associated from the first round of binders to then create a active learning module or a fine-tuned AI model that lets us go back into the NGS dataset and identify very rare clones that are often represented in these datasets as a singleton or a single representation. So in this situation, we added additional 52 binders for a total of 334, and since this is a fairly sequence-heavy approach, we're able to ensure a maximum sequence diversity, and in this situation of 122. The next step in the program is where we differentiate again, and this is where we can employ both XenProt and Xentient. So XenProt is then used to perform high-throughput humanization on all the binders coming out of the program, and Xentient is used to down-select, triage, and prioritize the developable clones. And in this situation, we ended up with 98 high-throughput humanized clones that then yielded 33 functional hits. So in this situation, how do we identify these binders from NGS data? Well, Ailux has developed a multimodal graph-based predictive AI that is made up of a number of different data sets, not necessarily limited to the representations on the screen. After we've created this pre-trained model, we then create project-specific fine-tuned models by incorporating the data associated with the first-round binders and non-binders to yield this fine-tuned AI model. And why do we think this is necessary? Well, we and obviously a number of others, because I've seen it come up in a number of other talks in the past couple days, feel that the immune repertoire is still often underexplored, even with modern technologies that allow us to dive deeper and deeper into the B-cell populations. The results are still heavily skewed to the expanded clonotypes that can be readily captured by traditional screening. Singleton clonotypes, however, clonotypes that only appear in the NGS datasets a single time, can still often escape examination. However, with our active learning modules, we're able to identify these clones at a much higher rate. So in relation to this case study, we produced an NGS dataset that was represented by approximately 117 different expanded clonotypes and around 1,200 singleton clonotypes, which is defined as clonotypes that appear in the B-set population at less than 0.05%. As you can see, based off of the data and how it progresses, if we were using random selection, we would be able to identify these singleton clones at less than 5%, compared to total clonotypes at around 36.4%. With our pre-trained model, we can increase these numbers to 15.4% for the singleton clonotypes and 54.1% for all clonotypes. But once we've implemented this fine-tuned model, this project-specific active learning, those numbers jump to 61.2% for the singleton clonotypes and 75.6% for all clonotypes. For me, though, one of the major questions is, what is the point of going after these singleton clonotypes? Been running antibody discovery programs for over 10 years, and people have always been obsessed with what they're missing out on, looking for the needle in the haystack, so to speak. And so often, I've wondered how much of it is just an academic exercise, but in this case study and a number of other case studies that we've run, we've been able to identify very interesting functional clones or very interesting clones in terms of specificity by diving into these very rare clones. So in this situation, you can see from the bar graph is that when comparing to a clinical benchmark, Speedplay, Smart Fluidics, in the first round of NGS binding all produced a very nice set of functional clones that match the clinical benchmark in some situation. But when we dive in and we look at these singleton clones, we do get a very interesting spread of functionality, some upwards of 140% functional inhibition. So at least in this situation, it's more than just expanding your lead selection in terms of diversity and potential epitope coverage. The second differentiating aspect to our discovery programs, as I mentioned, is our ability to perform high-throughput humanization as well as the in silico developability triage. So this slide represents our ability to do that high-throughput humanization, and depending on your antibody discovery philosophies, Ailux actually has a couple different options for humanization. In this situation, we're talking about high-throughput humanization, but we can also do what we call deep humanization, or essentially our ability to perform paratope grafting on a smaller number of leads that essentially reduces the number of non-human amino acids in the CDRs. But if your discovery philosophy is more directed towards eliminating the potential of late-stage attrition, this is a very good option to run a discovery program in that situation. So we do this by essentially taking the best combination of the closest structural germline developability while also limiting the number of potential back mutations. So we can humanize over 500 sequences a day. We actually do this by expressing a single variant per parental construct, and we have an 80% success rate based on attempting to or trying to keep the humanized variant within 5-fold of the parental while also maintaining a high degree of humanness. We also like to point out that this isn't limited just to wild-type mice. This is fairly species agnostic. We have the ability to perform this humanization on chickens, rabbits, and alpacas. So if somebody was interested in running a multi-species program against against a single target, we're able to humanize very early in the program and get a direct comparison of the antibody characteristics that are already humanized from a number of different species. The next slide then represents our ability to predict and then validate the developability characteristics of those humanized leads. You can see a good correlation between the wet lab outputs and then also the in silico predictions. The orange dots represent the predicted positive or well-behaved clones, whereas the blue dots represent the predicted poor clones, and they actually correlate quite well in terms of the wet lab validation. So in summary for this case study, basically Trilux 3-in-1 antibody discovery is our approach to producing diverse panels of humanized, functional, and developable leads. As you can see, we get very good sequence diversity, but we also can get very good epitope coverage. In this situation, we had 5 epitope bins, 2 of which overlapped with clinical benchmarks, 3 novel epitopes, 1 of which was only accessible through one of the singleton clones that we pulled out. The next case study that we're going to talk about is structure-guided hit expansions of epitope-specific functional antibodies. In this situation, we've identified functional leads, and we want to increase that panel in terms of functionality and sequence diversity. So the original antibody discovery program was actually, the goal of this was to identify a conformational epitope that is only present during the formation of a homotrimeric complex. So to do this, we actually created an AI-guided epitope-specific antigen, which actually is another case study that we're happy to discuss on another day. But we immunized mice with this epitope-specific antigen. We ran it through our Trilux 3-in-1 hit generation program where we identified 11 epitope-specific and functional hits. We then performed our structural guided hit prediction, which identified 30 potential add-ons. We then validated these and identified 12 antibodies that bound the same epitope and had the same relative or exhibited a desired functionality. So how do we do this? Well, essentially, we take the 11 functional lead candidates and we use those as seed antibodies where we extract certain structural features that include geometric features like shape and curvature, and also surface chemical features like hydropathy, electrostatics, and free electrons. We then have a proprietary method of ranking and scoring these structural features and then use them to go back into the NGS dataset and identify structurally similar clones. After we identify the structurally similar clones, we remove the sequence similar clones, and then this led us to the number of 30 predicted hits. Of those 30 predicted hits, 17 were confirmed binders, 15 were confirmed to be epitope-specific binders, 12 were then confirmed to have functionality. So the bar graph in the middle represents the epitope-specific binding nature of the new leads. The blue bar graph shows a wild-type antigen binding, where the white bar graph exhibits an epitope-replaced antigen. You can see that the benchmark on the far left binds both because it binds the monomeric version of the protein as well as the homotrimeric form, whereas the seed antibodies and the new structural variants exhibit the epitope-specific binding that we're looking for. We also then tested for the functionality, and on the far right, you can see the EC50s associated with the the functional inhibition of both the seed antibodies and the new structural functional hits. So at this point, we've demonstrated that we can identify new antibodies that bind the same epitope, new antibodies that have a similar function, but how did we do in terms of dissimilar sequences? So the original 11 functional antibodies could be broken down into 3 distinct clusters based off of their sequence output, whereas after we ran the structural guided approach, we ended up with 12 new functional hits that could be broken into 4 new distinct clusters. So the linkages between the dots is based off of HCDR3 similarities, and it's also come up a couple times in conversation in the last couple days. So not only were these actually dissimilar in terms of HCDR3 sequences, but we were actually able to identify antibodies that were structurally similar from different germlines as well. This then brings me to the last case study that I'm going to talk about. So this is the refinement portion of the talk, or our ability to perform multiparametric optimization. And this time it's demonstrated through the affinity modulation of a dual specificity cytokine receptor. In this case study, we were actually tasked with the following objectives. We were to increase the affinity of a receptor to cytokine A by 3-fold. We were to decrease the affinity of the receptor to cytokine B by 10-fold. We were also tasked with keeping a comparable level of developability between the mutant and the wild-type protein, while also identifying distinct and novel mutations that were not already disclosed by prior art. To begin the program, we were fortunate enough to actually have a crystal structure available for the receptor and cytokine A, but we did not have a crystal structure for the receptor and cytokine B. So we employed our crystal fold complex prediction algorithm and actually identified the fact or helped confirm that both cytokines shared a dual binding interface with the receptor, and we also identified 110 potential contact residues on the receptor. After we finished this program, they did release, or a crystal structure for the receptor and cytokine B was released, so we were able to essentially benchmark the crystal fold prediction. In this situation, we ended up with a DocQ score of 0.667 and an interface RMSD of 1.62 angstroms. So this, in our metrics, is a successful prediction. This slide represents kind of a simplistic snapshot of how we approach the multiparametric optimization programs. We generally begin with XenProt, so the generative large language model, and we apply the constraint. In this situation, it would be the 110 contact residues. We then have XenProt produce these fit sequences that I discussed, which drastically reduces the overall search space. These sequences are then down-selected and prioritized depending on the program. In this situation, it would be affinity and developability, at which point we then perform the wet lab and the validation, two-point binding, SPR, and then also monitored the yield and purity to ensure protein stability in this situation. The data from these outputs is then used for the iterative process and to continue through a number of rounds of optimization depending on the complexity of what we're looking for. So the quick snapshot of the summary of this program is it took 4 rounds of affinity modulation, and then we identified 7 mutants that fit the target product profile in terms of affinity changes as well as the developability aspects. But it's actually quite interesting to see how we actually progressed through the rounds and got to these final products. So beginning with round 1 and starting with the structural modeling, as I mentioned, we identified the 110 contact residues. These were then placed as a constraint on the large language model, and we also limited the potential mutations to a single amino acid per sequence. XenProt produced approximately 2,000 fit mutants that were then down-selected with Xentient to 45 prioritized mutants, which were then expressed and tested in the wet lab. As you can see from round 1, the pre-trained model didn't perform particularly great, trying to move us towards this target product profile that we were looking for. But as I've mentioned, we used the data from round 1 to create a fine-tuned model that was project-specific. So we went back to the original 2,000 mutants that XenProt had produced, and then we down-selected once again and identified 59 point mutations of interest. These were then used as the constraint within the large language model, and we increased the number of potential mutations combinations to 3. So we ended up with 5,000 combinatorial mutants that were down-selected to 96 prioritized hits, and once again, we expressed, tested, and validated in the wet lab. For round 2, we saw a moderate but still insufficient shift towards the target profile that we were looking for. And then this leads us to rounds 3 and 4. So based off of the data of round 2, we did a customized scoring function to identify the top 17 mutations. We then once again employed XenProt to produce new combinatorial mutants with a maximum number of mutations of up to 9. And then we ran through the process of down-selecting, expressing, testing, refining, and again. So rounds 3 and 4 then produced 7 hits that met the target profile that we were looking for. So obviously in this situation, we were able to decrease the affinity to cytokine B by 10-fold, increase the affinity to cytokine A by 3-fold, while also maintaining the overall developability of the protein. To summarize this case study, essentially we were able to leverage our 3 AI engines through 4 rounds of optimization. We expressed 233 variants and then identified 7 patentable novel variants at the output of the program. This is a relatively complex multi-parametric optimization program that we ran. We can use the same strategy in more simplified affinity modulation programs. This is just a very quick snapshot of a more simplified program that we ran. This started with a Fab with a 5.78 nanomolar. We then ran CrystalFold, identified the key critical residues in this, ran 2 rounds of optimization, expressed 65 variants. It took 5 weeks, and we ended up with a 13-fold increase in affinity with the top variant containing 3 amino acid mutations. So that summarizes the 3 case studies that we wanted to walk through today, but they were mainly focused on, obviously, hit generation and the multi-objective engineering and affinity modulation. We do have a number of other case studies that we'd be more than happy to walk through with people at the booth. One would be focused on Spotlight, or essentially our ability to create epitope-specific antigens for antibody discovery, our ability to probe through immune libraries through a combination of NGS and AI, as well as how we approach harder targets like GPCRs, ion channels, and PMHC. And with that, I'm more than happy to take some questions.